pain in the forehead, eye, cheek, back of the head, and crown, as well as dizziness, disorientation, sore throat, lacrimation, unilateral eye redness, and impaired vision and hearing can all result from problems with the sternocleidomastoid muscle. Watch the video to the end to learn the causes of these symptoms, muscle tests, exercises to help relieve discomfort at home, and helpful tips for preventing recurrence. I'm Dr. Chernov. Thank you for liking and subscribing. Special thanks to our new channel sponsors. The sternocleidomastoid muscle is located on the anterolateral surface of the neck and consists of two parts, the sternal and clavicular, which attach superiorly to the temporal bone. Inferiorly, the sternal part of the muscle attaches to the anterior surface of the manubrium of the sternum, and the clavicular part attaches to the clavicle. Specific areas of tension, or trigger points, located in the lower portion of the sternal bundle of muscles cause pain in the upper sternum and can trigger paroxysmal coughing. Trigger points located in the middle of the sternal bundle of muscles radiate pain to the upper jaw, supraorbital region, and deep into the orbit of the eye on the affected side. Trigger points located along the inner edge of the middle portion of the sternal bundle of muscles cause pain in the pharynx and dorsum of the tongue, causing a sore throat, and also refer pain to the top of the chin. Trigger points in the upper portion of the sternal bundle of muscles cause pain in the occipital region and crown of the head. Injury to the sternal portion of the sternocleidomastoid muscle, in addition to the pain patterns described above, may cause excessive lacrimation, redness of the eye, conjunctivitis, narrowing of the palpebral fissure, and visual impairment, including blurred vision. Sometimes nasal congestion and sinus congestion may develop on the affected side. Unilateral hearing loss may also occur. Trigger points located in the middle portion of the clavicular band of the sternocleidomastoid muscle refer pain to the forehead, while trigger points in the superior portion cause pain deep in the auricle, radiating to the space behind the ear. Since the sternocleidomastoid muscle is one of the main sources of spatial awareness in humans, damage to the clavicular portion of the muscle can cause spatial disturbances, dizziness, or a sensation of objects spinning due to head movements, fainting, and imbalance, sometimes leading to falls. Some reactions can be exaggerated. For example, looking up may cause a sensation of falling backwards, or lying on your back may create the illusion that the bed is tilted. A person with trigger points in the sternocleidomastoid muscle may have difficulty estimating the weight of objects, which can be an additional diagnostic test. If he is asked to estimate the weight of two identical objects of equal mass, then on the side of the affected muscle the object will be felt as lighter. The development and activation of trigger points in the sternocleidomastoid muscle is associated with a number of factors that lead to acute or chronic muscle overload. Forward head posture while working at a computer, excessive forward head tilt, such as while watching a long video on a smartphone, or sideways head tilt during a long phone call can all lead to muscle overload. An incorrectly adjusted pillow height or sleeping on two pillows can also cause sudden neck flexion and prolonged muscle shortening. Sleeping on the stomach with the head turned to the side or sleeping on a low pillow can also trigger the symptoms described above. Prolonged neck extension or constantly raising the arms above the head, such as while painting the ceiling, hanging laundry, or playing volleyball, can lead to the formation and activation of trigger points. Scoliosis or gait disturbances cause curvature of the shoulder girdle and excessive strain on the sternocleidomastoid muscle. Trigger point activation may also occur when reading horizontally with the head turned to one side. Chronic cough, asthma, and a number of other conditions cause strain on the accessory respiratory muscles, which include the sternocleidomastoid muscle. This cough can often be accompanied by severe headaches. A tight tie or shirt collar can compress the neck muscles and impair blood flow. If the sternocleidomastoid muscle is damaged, limited head tilt and rotation may occur. You can locate trigger points in the sternocleidomastoid muscle by palpating it yourself. If you have difficulty locating the muscle under the skin, turn your head to the side, and the sternal portion of the muscle on the opposite side of the neck will be exposed. Slowly and gently massage the entire muscle from its attachment to the sternum to the mastoid process of the temporal bone with 3 fingers of your left hand for several minutes. If you find areas of increased muscle tightness that, when pressed, cause pain in the back of the head, parietal region, above the eye socket, cheek, chin, anterior neck, or sternum, pause there for 15 to 30 seconds. Although the pain may be quite intense, don't be afraid to work these muscles. Simply adjust the massage intensity. Afterward, return your head to a neutral position and try to grasp the clavicular portion of the muscle, which lies slightly deeper and to the side with your fingers. If you have active trigger points in this muscle group, you'll find areas of increased tension that cause pain in the forehead and behind the ears. Be sure to repeat the self-massage of both muscle parts of the sternocleidomastoid muscle on the opposite side of the neck. Even if the pain disappears after the first session, continue massaging these muscles for several days or even several weeks until there are no more painful or tight areas. After the self-massage, stretch the muscle. Since the sternocleidomastoid muscle is involved in neck flexion and lateral head tilt, you can stretch it by extending your neck and tilting your head to the opposite side. Hold the final position for 1 to 3 minutes and breathe deeply and calmly through your nose. To increase the stretch, you can use your hand. This exercise also helps stretch the upper trapezius, levator scapulae, and scalens. Be sure to repeat the exercise on the other side. If trigger points are detected in the sternocleidomastoid muscle, this indicates overload of the entire superficial frontal line, as described by Thomas Myers, which also includes the rectus abdominis, quadriceps femoris, and the extensors of the toes, brevis and longus. Stretching the entire superficial frontal line, and the sternocleidomastoid muscle in particular, can be achieved through a number of yoga exercises that include back bends. These include warrior pose, virabhadrasana, upward facing dog pose, urdhva mukha svanasana, camel pose, ushtrasana, fish pose, matsyasana, bridge pose, urdhva dhanurasana, and a number of other exercises. After massage and stretching, it's helpful to apply a moist hot pack. Then, perform 3 cycles of active but slow forward and backward head movements, from full shortening to full lengthening. Then flex your neck while turning your head as you exhale, and extend your neck while turning your head as you inhale. Repeat these 3 cycles and then switch sides. It's important to keep in mind that the technique described above is a quick fix that affects the final link in the pathological chain. To prevent trigger points from forming again, it's essential to regularly perform a comprehensive exercise program that will evenly strengthen all neck muscles and maintain them in optimal condition. It's also critical to eliminate all long-term harmful factors. Avoid prolonged forward head posture and rounded shoulders. Correct your head position while walking and sitting for long periods. Keep your smartphone or computer screen level with your face. Hold the phone receiver to your ear or use a headset while talking, without tilting your head to the side. When swimming, be very careful not to strain your neck muscles by constantly turning your head to the side. Avoid prolonged positions with your head tilted back and raising your arms. If scoliosis or other postural disorders are present, it is necessary to determine the cause and achieve correction, which will lead to alignment of the upper shoulder girdle and even muscle loading. Choosing a pillow and sleeping position are crucial in preventing and eliminating trigger points in the sternocleidomastoid muscle. If you sleep on your back, a small pillow or bolster should be placed under your neck to maintain the physiological lordosis of the cervical spine, or the front edges of a larger pillow should be positioned forward. Avoid turning your head during sleep, which can lead to prolonged muscle shortening. When lying on your side, position your pillow so that your head is in a neutral position. Avoid placing the pillow under the shoulder joint or tilting the chin, as this can trigger points not only in the sternocleidomastoid muscle but also in the scalene muscles, causing numbness and pain in the arm, extending to the thumb and index finger. I'd love it if you shared this video on social media with your friends who suffer from myofascial pain. Check out the pain relief playlist for a detailed overview of the scalene muscles and other muscles. Thanks for liking and subscribing, and a huge thank you again to the channel's new sponsors. If you'd like to support the project, the link is in the description. Stay healthy.